Hi, everybody. Good morning. My name is Joan Altman. I direct government affairs and strategic partnerships here at the Exchange. I use she, her pronouns, and I'm excited to welcome everyone today to our annual public forum. This is a required meeting under our 1332 waiver requirements, and we're thrilled to have you join and to also be recording. This event is both in person and online. So a few logistical pieces before we get started. First, in this Teams live meeting, you can turn on live captions and subtitles. There are instructions on screen on how to do that. And if you need further assistance, please feel free to use the Q&A box to enter your questions. And we have staff who are supporting this meeting who can help you. The next slide speaks to a little bit about the meeting and how we're proceeding today. So the slides for this meeting are available on our Section 1332 website. There's a link to where you can find more information about this event, and the slides are posted there. Also, just wanted to provide an update for everyone participating in the meeting today that the meeting is going to be recorded. So we will make that recording available, and also public comment that you give as part of this meeting will be part of that recording as well. The final logistical welcome slide lets you know about the purpose of today's meeting, which is to provide public comment. So the next slide will show you how you can submit your comments today and how you can submit comments following the meeting as desired. So everyone who's joining today can feel free, if of interest, to introduce yourself by putting your name and your organization in the QA box. Really, I'm going to provide some introductory information, and then we will reserve time afterwards to accept any public comments that folks may have on the progress of our Section 1332 waiver. You can submit comments in person by raising your hand and we'll call on you. You can submit comments virtually in the Q&A box. Please just sort of indicate that you're making a public comment as separate from any other questions you may have, and go ahead and enter that. And finally, following the meeting, or if you're someone who's watching the recording, you can submit an email to our Washington 1332, our annual public forum, our 1332 inbox with annual public forum in the comment line. So that completes our logistics. Before I'm going to present for 15 to 20 minutes on what we've been up to with the waiver and how the launch has gone, and then we'll turn to public comment and then likely close out. I'm not seeing any chat or Q&A questions, so we'll move forward. So again, thanks for joining. This is our Immigrant Health Coverage Annual Public Forum. The next slide shows you some of the topics that we'll be covering today. I'm joined by staff from the Exchange, including Lisa Johnson, our new Immigrant Health Coordinator, Joanna Dombeck, Jenny Arredondo, and a host of others who are helping make today happen. So wanted to make sure we acknowledge and thank them. The next slide shows you how we'll present some information to you. I'll provide a brief waiver background and overview. Then we'll provide some implementation highlights. The launch certainly wasn't a singular event. It was the work of lots of great community-based partners and assisters across the state who helped us prepare and then execute the launch. We'll cover a few initial outcomes from what we've seen so far since November 1st. 2023, and then we'll go ahead and turn it over for public comment. The next slide starts us with the waiver overview. So as a reminder, on the next slide, you'll see a little bit about why states pursue 1332 waivers. So this is a vehicle that the federal government allows states to pursue when they want to provide strategies sort of ancillary to the Affordable Care Act that help further improve access and affordability for people in their state. Waivers are approved in 5-year increments, and every year we have to meet a series of reporting requirements to the federal government to sort of ensure continued approval over that 5-year period. And under the waiver, we're also required to host an annual public award forum, which is why we are chatting with all of you today. The next slide continues with some context for how this waiver came to be in Washington State. It's Washington State's first 1332 waiver, which we are continue to be excited about. First, over the past several years, the legislature has directed us to take a series of steps to improve affordability and access in Washington. That started with in 2021 with implementation of our standard and our public option plans. It continued in 2023 with the implementation of our state premium subsidy. And most recently for 2024, under the waiver, we expanded the populations who can shop for health coverage and dental coverage through the exchange. And that is our focus today. The next slide continues to provide a bit of context for our waiver. These are updated data provided by our friends over in the governor's office at OFM. The data in the state continues to show that being undocumented is the strongest predictor of being uninsured in our state. People who are undocumented are facing 5 times higher uninsured rates than others. So we're hoping that through a combination of the initiatives that are being taken this year and over the next year, we're able to help address a bit of that disparity. The next slide pivots us to why we did the waiver, what the goals were. First, really, it's to enable that everyone in Washington, regardless of their immigration status, can access Washington Health Plan Finder, access the state design standard and public option plans, and access health and dental insurance. It also ensures that everyone low income in our state can access state premium subsidies. It allows families with members with different immigration statuses to purchase coverage together, enroll in the same plan, and it sort of maximizes the safeguards we have through Washington Health Plan Finder to keep data secure and safe. That's the broader goals are, of course, to lower the uninsured rate, strengthen our health insurance market here in Washington, and enable the state in looking forward to potentially benefit from pass-through savings that you can accrue at the federal level and bring back to the state. The next slide moves you to what the qualified health plan and dental expansion is. So if we click through these bullets here, you'll see first that we applied for the waiver on May 13th, 2022. We went through a robust review process with CMS, IRS, Treasury, and others. We were the first in kind waiver, so they had questions for us and we had answers for them. It was approved December 9th, 2022 for 2024. So the waiver, the 5-year waiver period is 2024 to 2029. It allows everyone to come through and purchase a health and dental plan. And importantly, the next slide sort of highlights that the portion of the Affordable Care Act that prevents people from signing up for health coverage could be waived. The portion of the Affordable Care Act that prevents people who are undocumented from receiving any federal or subsidies could not be waived. So you'll see, and part of the theme of what we'll talk about today is how the state subsidy is helping making premiums, making them more affordable. We still see affordability barriers that remain, and that's something we'll be working on at the state level moving forward. Also, you'll hear more about how throughout the waiver process and through leveraging trusted messengers and community, we try to address privacy concerns that were raised and were a theme sort of throughout the public comment and implementation process. Moving to the next slide, this provides an overview of the timeline that I just mentioned. So you could see this sort of happens over a 2-year period, really, where you draft the waiver, you do a public comment period at the state and federal level, you do your tribal consultations, you submit the waiver, it's reviewed at the federal government level, it gets approved, and then through the summer and fall, we've been doing outreach and community engagement activities that you'll hear more about for our launch, which happened on November 1st, 2023, for coverage that began starting in January of 2024. Okay, next slide. Let's talk about what we did to prepare for the launch before we talk about some of the initial outcomes that we've seen. The next slide steps you through some of the implementation highlights. First, I'll note that our community engagement and our began well before we had even submitted the waiver, and then continued throughout the implementation process. So really want to thank and acknowledge our community-based partners on the line and in community who've helped make this a success. We sort of started with listening sessions in community across the state, facilitated by some of our navigator lead organizations. We engaged partners in the health sector and the community-based nonprofits across the state to help us further understand the population we're hoping to serve through the waiver. And then started our educational and outreach campaign, which has included working with some sort of nationally recognized folks to help us develop materials that we pushed out, and then through our navigator networks and otherwise. So again, a lot of those materials are available and were presented, and certainly can help people access them if they need to. The next slide, in addition to sort of talking about what we did to engage community, we wanted to make sure we shared what came out of community, what we heard. By far and away, the top 3 reported access barriers from impacted community members were affordability, mistrust of government and government websites, and health literacy and language access challenges. So we'll talk about each of those in turn. The next slide speaks to the affordability barrier. We're incredibly lucky in the state of Washington that the legislature has appropriated funding for a state premium-based subsidy. This is bringing premiums down to, on average, around $200 per member per month. So you can see here, this is an example of a newly eligible customer who lives in Renton. Their premium would be close to $400. They're receiving $250 per member per month off. And as a result, their net premium is down to $132. Acknowledging that that is still too expensive for some, we are pleased that the state subsidy is lowering premiums, and we think that's a critical part of what has made the program successful to date. The next slide speaks to some of the privacy considerations that were raised. We are really pleased Wizen and the Health Equity for Immigrants campaign and other community-based partners have done some good work in speaking to community about distrust of the healthcare system and distrust of sharing information with government that really informed how we proceeded forward with both the waiver negotiation, and our launch and implementation. So in addition to the listening sessions and the landscape scans, is part of our negotiations with CMS and Treasury. We sort of negotiated some first-in-kind federal protections to help ensure aggregates only shared at the information's only shared at the aggregate level. It's only shared for waiver-related purposes and not in any way used for enforcement. In addition to sort of federal safeguards at the state level, we, within the exchange, sort of did an end-to-end review of our system, developed a new data policy, developed new ways of transferring data with our federal partners to ensure that identities weren't disclosed. And we updated our identity proofing policies and procedures here at the exchange to allow more people to identify who they are in accordance with federal guidelines without facing a burden or running into an access barrier there. The next slide speaks to the health literacy and language access efforts that we've made. We've been working with, partnering with the VITA agency, which is a multicultural marketing firm that's helped to really support and develop some of our education and outreach materials in partnership with some community-based organizations and leaders who've been engaging with us on development of all of our translated materials. Part of what was emphasized as needed by community for the expansion population was really focusing on what health insurance is, why it's important, where you can find language in your own language, information in your own language, and some information about how it relates to public charge and your immigration status. So we really worked to create information in multiple languages, in multiple formats. We have video and print and digital materials. We did some community-based art projects, really trying to work in as many mediums as possible to let people know about the new coverage opportunity. We also really wanted to leverage our trusted community-based partners. So in working with the legislature and others, were able to secure some funding to provide to our navigator and our sister networks, our sisters and brokers across the state to help facilitate outreach and enrollment assistance. And we were also able to provide some stipends directly to our community-based partners to work with in language with specific communities across the state. The next several slides show you some examples of the materials and the collateral that we were able to put together. We did flyers and brochures and FAQs that are all available on our website. We also, next slide, shows you some of the languages that we made these materials available in. And we heard feedback that was really helpful in reaching community and appreciated on our part. So we're happy to be able to do that. The next slide shows you a bit of our multimedia campaign. So we were active online and in social media, also in drop-ins and sort of providing images and graphics that could be circulated by community-based partners in the publications and vehicles that they use. The next slide shows you where our state certified assistor network is. We are pleased to have over 3,000 people across the state who've been trained and certified to provide outreach and enrollment assistance. And you'll see in the outcomes that several people relied on that assistance to get enrolled. So pleased that throughout the state, we have lead organizations who communities can connect with. And we've already seen our partner network and our navigator network grow as a result of doing the waiver, which we're pleased about and will make all of our programming and all of our outreach and enrollment more inclusive. The next slide shows you some of the organizations that we provided CPO outreach stipends to, and some of the languages they provided that outreach and information in, and some of the activities they did. And again, just can't acknowledge and thank our on-the-ground partners enough for their efforts in helping reach a significant number of the undocumented population in Washington. The next slide just rounds out who we were able to provide that funding to. Having trusted community members participate in our outreach and enrollment and engagement has been critical as we move forward as part of this process. I'll pause there. That sort of summarizes what we've done. Check with folks in the room to see if there are any questions we need to address. Appreciate the whirlwind nature of taking you through our last 2 to 3 years of preparation for November 1st. The next section sort of orients you to what we've seen so far. We know it's the beginning. We know people are continuing to enroll and come in, but we'll show you what we've seen to date. So the next slide is, again, just an overview of how things looked for our most recent open enrollment period. A little bit different, a little bit more expansive than prior years, but essentially starting November 1st, anyone in Washington could come in, regardless of their immigration status or income level, and purchase a qualified health and dental plan through the exchange. So since the exchange launched, we have provided an integrated platform that provides access to both Medicaid programs and private coverage and federal and state subsidies. So a benefit here in Washington to how that is structured is that if we have state-only Medicaid programs that serve people who are undocumented, that doorway has stayed consistent and the same. What has changed is that the doorway to the qualified health plans and qualified dental plans has been newly opened. So previously, when someone would have gotten a message saying they're not eligible for any additional form of coverage, if they didn't fit into the existing state coverage programs, now everyone has an opportunity to purchase and buy coverage. Folks who are able to come in and purchase coverage can access our Cascade Care plans, our public option, and our standard plans, and they can receive state premium subsidies if their income is up to 250% of the federal poverty level. But again, due to the restrictions I mentioned earlier, you can't receive any federal premium subsidies or any cost sharing subsidies. So what happened? What did we see? The next slide shows you some of our top line findings, and there's information later that shows you how you can access further detail as desired. But essentially, we know there are 100,000 uninsured, undocumented people here in the state of Washington, to the extent that it's been reported in census and other vehicles. 24,000 of them, so a quarter of the people who are uninsured and undocumented in our state, applied for health coverage since November 1st. We were very pleased to see the level of engagement and activity. Again, credit to the materials, the partnerships on the ground to really help address concern about mistrust in government websites, sort of an unprecedented number of people to come through and newly apply for health coverage. We are pleased that the folks are now through our system. They're identity proofed and they are prepared and able and ready to purchase coverage should they be able to afford it. We did see continued affordability challenges. Of the 24,000 people who signed up, so far 2,200 have signed up and paid for coverage. Vast majority of them are people who are receiving the state premium subsidy. So we know for the over 250% of the federal poverty level, which is, right around $40,000 a year for a family of one, $50,000 for a family of two. We know as you are getting above those income thresholds, our coverage becomes harder to afford without any of the federal subsidies. So again, something that we'll continue to look at and monitor moving forward. The next slide shows you some details about the 2,200 people that we've seen come in and get covered so far. Of note, people who are coming in under the waiver, who we refer to as IHC customers in these slides, they're significantly younger. So 93% are under age 55, compared to just, sort of 70% of the general qualified health plan population. So again, 7% over 55 compared to 31%. There are questions and concerns about who would come in and how it might impact premiums and the risk pool. And we're pleased that we're showing that we have a wide variety of younger folks coming in and getting covered. The next slide shows you top lines by race and ethnicity. Again, the diversity of the customers we've been able to reach through the expansion is really notable. First, 75% of the IHC or the waiver population identified as non-white, compared to 30% of our overall qualified health plan customers. And looking at ethnicity, it's pretty staggering. Almost 80% of the people who come in under the waiver identify as Hispanic, as opposed to just 14% of those in our overall qualified health plan population. So very statistically significant difference there. The next slide continues to show you who benefited from this trusted community-based assistance that was provided. Again, nearly 70% of people either used a navigator or a broker or both. So 2/3 of people coming in and getting help, getting through the application process, uploading any required documents, navigating identity proofing. We're pleased to see that that one-on-one assistance that we enhanced for as part of the launch was utilized and helpful to people. The next slide moves us to the ongoing enrollment opportunities that are still available. So anyone working with clients who are undocumented or could benefit from this new expansion still can come in and sign up. You can create an account through Washington Health Plan Finder at any time, whether you sign up for coverage or you don't. Most of what we see in terms of annual enrollment activity happens during our open enrollment period, but there are special enrollment opportunities for anyone outside of open enrollment who needs to come in and get coverage. Most notably, people who qualify for our state subsidy, which, as we saw, were 90% of the people who signed up under the expansion. If you are eligible for our state subsidy and you are not already in a plan where you're taking advantage of that state subsidy, you can come in on a monthly basis and enroll. We see a lot of people who are using the special enrollment period, so we want to make sure we continue to talk about the continued opportunities for people to come in and sign up if they need coverage. And people can also call us or work with an assister, either a navigator or broker, to see if there are special enrollment periods that they still qualify for. Moving to the next slide, we can sort of see here the resources that are available for anyone who wants further information on our website, on the waiver itself, the federal website has additional information, including our sort of contractual documents that we adhere to under the waiver. We have our partner toolkit, which has the social media and the handouts and the flyers that I mentioned earlier. And then we have a data snapshot online that takes a deeper dive into who we've seen come and sign up for coverage so far to date. So more information available for anyone who wants to dig in. And again, if there's a resource you need that you haven't seen from us, welcome that feedback either via Q&A in this webinar or otherwise, as we continue to look at what materials we developed, how they were received in community, and then refine and update and adapt as we move forward. What are we up to next? What are the next steps besides having this forum and checking some boxes in terms of federal reports that we have coming up over the next several months? We're sort of pleased with the launch, continuing to engage impacted communities, to do lessons learned, and to continue to spread the word about ongoing special enrollment opportunities. In the state of Washington, we're also expanding the Medicaid program to people who are undocumented and up to 138% of the federal poverty level later this summer. So again, many of the people who come in through the qualified health plan expansion will, if you're lower income, you will be eligible to transition and or newly sign up for that new state program. So working closely with our Medicaid agency partners there on how to facilitate that transition and how to translate some of the lessons learned from the qualified health plan and dental plan launch over to the Apple Health side. Pleased that we can leverage some of the materials and messaging that we developed under the waiver. So excited for the state to move forward there and to sort of leverage some of these partnerships that we've developed and materials we've developed looking ahead. So July 1, we'll be looking to support the Medicaid expansion and then looking ahead to the following open enrollment for the waiver. And that concludes the sort of background and history of the waiver, how we got here, who we worked with, how we launched the waiver, the data that we've seen to date. And we've come to the purpose of today's meeting, which is public comment. So I'll invite people to enter public comments in Q&A. We'll give a few minutes to see if there's anyone in the room who would like to make a public comment for the record. And the next slide does remind you and show you how to submit a public comment, whether as part of the forum today, in person or virtually, or over email. So I will pause for a moment and see if there are any public comments that people would like to make and share with us today. Okay, seeing no questions here in the room or online, we'll remind everyone that you have until 5 p.m. on April 18th to submit your written comment. We encourage and welcome people who've been, sort of impacted by the waiver and or who are appreciative of that effort to share thoughts with us. Otherwise, we will be continuing to connect with community, connect through our Health Equity Technical Advisory Committee, connect through our community-based advisory groups on next steps. Really appreciate the engagement of everyone who's already been so highly engaged in this effort and so pivotal to making it a success. Looking forward to continued collaboration as we move forward. We'll do one final check of the room and online. Great. Well, thank you so much. Thanks to those online who I see have joined us, and we will look forward to continued partnership. Thanks.